May it please you, my lord. Okay. Appearance of the parties is as before. I have been informed that Council Kabega is also around. Okay. The assessors are also in court, my lord, and all the 5 accused are also present, with A1 appearing from Luzira Women Prisons. My lord, we are ready to continue with the cross-examination of defense witness number 3. My colleague Jonathan will take over.
Thank you, my lord. My lord, we are just debating as to the exact point we ended, if we may be favored with a reminder.
Let me try to find it. Just give me a few minutes. Can I read the last page? Will that orient you properly? Okay. I operated the patient, followed up the patient until she healed, and I removed the pins. I am not in position to remember what I put in my notes. The person I instructed to make notes on the review of the patient made review notes in the file. The witness is given a document. This is part of the patient's file. It indicates myself and Dr. Onen as the doctors managing the accused. It is dated 2nd November 2023. According to the form I was managing, as stated on page 2, I do not remember interacting with this form in the course of managing the patient. Part 2, anesthetics report can be in the emergency or in the theater. I did not write on this part, it is for the anesthetist. Me, I wrote on the last page, it is page 15. Page 14 has operation notes. This form is numbered sequentially from page 1 to 13, but I do not see page 14. But page 14 is visible in the stamp. My form is 15. I wrote in that form, that is my handwriting. It is headed clinical notes. Before I managed the patient, I was interested in her vitals. This was to know that she was fit and to know that I had to be quick in my duty of treating her. It would help me to know if she was critical or stable. Witness is led to page 4, where the patient's vitals were recorded. According to the nursing notes, the patient was fully conscious, awake, alert, and well-oriented. According to the central nervous system examination by the nurse, to be fully conscious, it means that the patient is awake, not drowsy, spontaneous, and responds to voice and touch. Spontaneous means the patient responds to instructions. In medical terms, to be awake means the patient is conscious. What alert means in English, it means the person is awake. When a person is said to be well-oriented, it means the person knows their name, where they are, time of day, and the year. It means the patient knows their name and date and time. It is false that I was not near IHK. between 9 a.m. and 11 a.m. That's where we ended.
My Lord, may we pray for exhibits 100, 101, 102, 103, A, B, C, and D. From 100 up to 103. Doctor, you ready to begin?
It's okay.
Okay.
I'm ready.
As usual, switch on the microphone. If it's Doctor, from where we ended, you as an officer coming from IHK, can you vouch for the authenticity of the medical documents from your hospital attributed to Ms. Mole Katanga?
I can only vouch for where I wrote or where I recorded. I think that's the duty of the administrator of the hospital.
We understood you to say that you reviewed this patient several times, and the review entails reading the patient's file, correct?
Not necessarily.
Did you read the patient's file on your review sessions?
My Lord, when you go to see a patient...
Did you read the patient's file?
Can I answer the question, my Lord?
Did you read
Yeah.
or did you not?
Yes.
Did you
I read the relevant part I want to see, if I need to read. Okay? But if I'm with the ward doctor, sometimes I don't have to go through all the details every time I go there.
Thank you, but now tell court whether you read.
My Lord, the witness
Did
has
you read
answered.
the relevant parts?
My Lord, he said, I read the relevant parts
Yes.
I want to see. I read the relevant parts I
The
want to
relevant
see.
parts I want to see as a surgeon.
So on this case, you read the relevant parts.
Yes, to my profession.
Doctor, what relevant parts?
I'm an orthopedic surgeon, and my role in this patient was
That
to handle
answers
the
to which
orthopedic
question?
cases, orthopedic management of the patient.
May he be advised to answer questions?
That's what I'm answering.
Mr. Mwaganya, please ask your question again.
So, in this case, what relevant parts Do you
We
commit to
manage
have
the
read?
patient as a team. There's an anesthesiology team, there's the neurosurgeon, and there's the orthopedic surgeon.
So for you as
my
the-
role
you
is
as the
to
orthopedic
to
part
handle the
surgeon,
orthopedic part of the.
You read the parts
yes.
relating to?
And I read the X-rays, and I saw, and I also reviewed the patient, and then that's what I can. I confidently address.
Again, what should be clear to this court, Dr. Sachimpi? At the point of first interaction with the patient, going by your description of who Mole Katanga was to you at the time, did you address your mind to the cause for which she had been admitted in your hospital before attending to her?
Yes, I attended to the
What
patient.
was the cause as per the file?
As per the file, the cause was road traffic accident at that very
Please.
point. That's what was recorded. Yeah.
I'm taking you to, my Lord, Prosecution Exhibit 103A. I just want you to confirm to this court, officer. One 103A. Officer, take it to them.
My Lord, I think we have done this objection before, and we have a court decision on it, guidance on it. This exhibit was not at all authored, filled, signed by the doctor. He's very categorical. There are many people who attended too. And he answered. He said, hospital documents, I can only vouch for those where I wrote. The rest, the duty is for the hospital administrator.
Mr. Mwaganya, what's the background of that document?
He can't speak to it.
Let us hear the background.
My Lord, he read, and what was recorded in the file
That was part of the file.
was road traffic accident. This is the assessment form by which the client, his client was admitted. I just want to confirm, because I don't know, he can tell us that he never read this. But
It was part of the file.
yes.
Let him answer.
You see, he's asking me when you arrived.
Doctor, I've not
No,
yet asked you
first-
anything. Don't
So
engage
you asked
in
me.
our...
Doctor,
Yes.
just a moment.
Please.
Wait for the question.
Yeah. So,
Wait for the question.
yes, let me wait for the question. Ask.
Did you find that form in the file?
I would not record after 3 years exactly what form I saw or
My Lord,
I
we are
found.
addressing 103A.
103A. Yes, I cannot be sure. I would be lying in court.
So, Doctor, even after your appearance here
Yeah.
and the long adjournment that you had, and necessity for you to acquaint yourself with the correct information on your client, you have not addressed your mind to the file in the management of your hospital?
Yes, I've not tried to go and dig into the file because
Okay.
I have a role which was orthopedic injury management. I would be biasing myself to go and try to dig and defend myself. I want to be truthful. So I don't have any interest in the case other than being the doctor of the accused.
I want to advise you to restrict your answers to our specific questions.
Yes. That's the answer I've given, sir.
Okay, the reason I say so, I understand you're a busy man and we need to get done with you. But when you overindulge, we are likely to take longer here. Please.
So you said that after you appeared here, you have not tried to dig into the file?
No, I've not.
Now, let's save the time of this court. My Lord,
Right.
Mr. Kavegas has landed. Mr. Mawanda. Now, let's be clear to this court, clear and fair to this court. Which form did you read in the patient's file where you got information that she had reported road traffic accident?
When we arrive in
Which
emergency,
form, my Lord, requires a specific?
I don't have to read a form, my Lord. When I
Okay.
yes.
Where did you?
Doctor.
Where in the file did you read?
Listen and answer.
This, can I answer, my Lord?
He has asked you, you gave information that
Yes.
it was a road, according to the file, the
no.
cause of the injury
Yes.
was a road traffic accident.
Yes.
So where was that?
So
in the
he's
file?
asking you, where in the file was that?
In the emergency sheet at that point. Because, and also I
In the
inquired
emergency,
on the emergency assessment, whatever form.
Was in the
emergency
emergency
assessment
Whatever,
form.
yeah, what of, yes,
Emergency
Assessment form.
yeah.
Doctor, just confirm to this court that the document I placed before you is the emergency assessment form, isn't it?
So at that time,
No, doctor,
Is it or it is
yes,
doctor, you just read and say, according to what I read.
yes, according to what I read, it's the emergency assessment form.
Can you read the first, what is indicated in the first sentence under detailed history of the
Patient presents with the RTC. Okay, RTC is road traffic crash.
road traffic crash?
Yes.
Okay.
Coma, unclear mechanism of injury, and was in a car crash.
Full stop.
Yeah, full
And
stop.
was in a car crash. Now, I want you to go to the second page of that form.
Evidence about what someone else filled on this form? My Lord, because I think it's a problem because what we are doing, this witness is under oath to tell the truth as he knows it, and we are simply giving him forms written by other people that he says he can't even remember reading and asking him to read those forms.
You see
Is that appropriate?
That form is part of the emergency assessment form. And him, as the team of doctors, looked at that form.
My
and
Lord,
looked at the file.
My Lord,
He said that the information on the accident he got from the file. But he has also said he cannot remember if
Yes.
that
If he
is
looked
the
at this
exact
form.
form. But he
Yes.
has read and said this is the emergency assessment form. And
Yes.
according to that form,
Yes, because
he's being asked according to that form, which he
Yes.
interacted with.
no, my Lord, the fact that he can't remember interacting with that form, and the second point, my Lord, even if he did interact with it, my Lord, what someone else wrote, based on what that person had from wherever they had it from, is what we call hearsay evidence, and cannot be elicited through cross-examination. My land friend is told his horses, we shall supply him with the person who filled the form.
My Lord, I want to strongly detest and object the practice of the defense to imagine that they can determine what we should ask in cross-examination and what we should not. My Lord, any objection must be rooted in law. Any objection.
My Lord, maybe
Can
if
I
I can
address court, Mr.
My Lord,
Karwanga?
maybe I can clarify the law.
No.
The law is the law of hearsay.
My Lord, I am not willing for Mr. Karuhanga to keep doing these unethical interactions. We agreed that when a colleague is holding the floor, he should have the courtesy of being patient. Otherwise, we end up exchanging in this court. My Lord, this is
I seek protection. I shouldn't be personally
cross-examination.
attacked.
The
My land
defense-
friend is in the habit of personally attacking me. I am entitled to raise a legal objection. If it irritates him, that is not my problem. I am entitled to raise a legal objection. It is not proper for him to say that the raising of objections is unethical. I may be right, I may be wrong, the court may rule, and we move on. We've raised objections, they have ruled. So for
Yes,
my learned
Mr.
friend to try and
yes,
gag me,
Yes, Mr. Karuhanga.
especially with such bad language, my Lord, I really ask for
Please.
protection.
My Lord, I repeat,
Please
it is,
restrain you.
it is
Please, no.
unethical to the extent that he
Mr.
interrupts a colleague when he's holding the floor, my Lord.
Mr.
That
Mr.
one, my Lord,
Mwaganya.
it is unethical. It is not allowed.
Mr. Mwaganya, let us avoid using words that bring the character and professional integrity of our colleagues into question. So, Mr. Karuhanga, you have raised the objection. Mr. Mwaganya, respond to the objection.
My Lord, I have not even understood what objection. I want only to respond to objections rooted in law. My Lord, we are tired
My Lord, here
of
is the
responding to
objection.
feelings of lawyers.
My Lord, here is the objection. and
Let
it is
him
rooted
cite
in
the law, we respond
is
to
that
law.
the law of hearsay, you cannot enlist hearsay from a witness. The objection is that you cannot enlist hearsay from the witness. A witness can only testify to matters within his knowledge. This witness performed, he's an orthopedic surgeon. And any document, and he has said so, any document that I did, I will testify to it. The others, I will not, because that's the duty of the hospital administrator. And my Lord, the hospital administrator will be here next. Any form that he has no handwriting or name, you can't put it to him. On this form, my Lord, he's done nothing. For him, therefore, to confirm the things there as if he did them, is to invite hearsay from him. You can't make him read and move on. Especially, my Lord, when he said, I can't even confirm their authenticity. The witness has said, these hospital documents, I don't know, I can't vouch for their authenticity, except where there is my handwriting or signature. So he doesn't know whether this form is actually authentic or not. That authenticity can only be done by the hospital administrator. So, my Lord, the business of bringing professionals here, and then we ask him about the A to Z of running a hospital when somebody walks into a hospital, does surgery and leaves, is enlisting hearsay.
Mr. Mwaganya, please respond.
My Lord, I have not been referred to any law that the process is bleaching. I have only listened to opinions from Mr. Karuhanga and Mr. Tumwebaze. As far as we are concerned, my Lord, cross-examination cannot be restricted on any matter, my Lord, except matters prohibited under section, if I may, my Lord, under section 150 and 151 of the Evidence Act, specifically restricting indecent and scandalous questions or questions intended to insult or annoy. My Lord, in cross-examination, we do not only ask what people should know. We don't ask what people should know. It is the duty of the witness on the stand to provide the answers to court. If the position is that they don't know, my Lord, the witnesses must say so. It cannot be assumed by counsel that the witness cannot provide an answer. At this point, my Lord, this court does not know what this witness did or did not do. court can only establish those facts through the answers he provides. And so we find it incorrect for our colleagues to assume that we are restricted to specific manner of questions.
Mr. Mwaganya, you lead the witness.
Most obliged. Doctor, do we understand you to say that you can only commit to only that which you wrote in the medical forms? And,
Yes.
And no more?
Because of the period that has,
Please.
yes, I commit to what I saw and I wrote, okay, in as far as managing the patient is concerned. In my area of
So
profession.
anything which you never saw, you can't answer to it. Anything which you never wrote, you can't answer to it, correct? Correct? Or
Unless I'm the one who dictated it.
Now, we are going to make it quite easy. Let's get the defense disclosures. These are the medical documents of Ms. Katanga that the defense disclosed to us. We want to save on the time of this court. These are the documents I'm giving you, please. Are we good? We want to save on this court's time. Sort out those that you wrote and those that you dictated so that we concentrate there. Okay, those that you saw, those that you wrote, those that you dictated. I have stickers here. Use them to mark. Okay, so, hey, give him, so, sorry. What is the first document?
Patient consent to procedure and operation.
The second? So you know this one because you saw it or because you wrote it?
Is that the first document?
Yes, my lord.
Yes, I wrote. That's my handwriting. Because you have to consent. And then the notes
Next.
I wrote after surgery.
Notes
15.
after surgery. Next.
The report I made
Report you made to who?
to the police surgeon. Request of the police surgeon.
Dated
I
when?
did the report. So this is 13th November,
Which year?
2023.
Next.
Then the notes I dictated when I was reviewing the patient.
Notes you dictated.
Yes, after reviewing the patient, because usually they write your name up and cross it there.
These notes you dictated to who?
To the ward doctor.
Does
To the ward
he or
doctor.
she bear a name?
I'm sorry, the document is so faint.
I thought you were the one who dictated to a certain colleague that you were.
2 years and a half ago. I'm not a genius.
Okay.
I don't have that memory
So,
too,
doctor,
because the doctors are so many on the ward.
Simply say, I cannot remember.
Yes, I cannot
It's
remember the
a long
exact
time.
specific
Cannot
doctor. It's a
remember
long
the
term.
doctor.
Yeah.
And
but this is what we do.
And the name is not visible on the document.
It is there, but it's very faint, Your Honor. It's a photocopy.
I can read the name Dr. Naruoga.
Dr. Naruoga.
Can you also be in position to confirm that it's Dr. Naruoga? Without it's about fairness and the
Yeah.
being straight.
Does it look like Naruoga?
Naruoga.
It's actually clear.
On your copy, does it look like Naruoga?
I
Look
think,
at the end of the document where there is a stamp.
Your Honor, let me tell you, I'm very truthful to this court.
Yes.
What I
Doctor,
do and what I see,
You've said it's faint.
it's faint.
And you can't see. He's
And I
saying
say-
his is clear.
Yes.
It reads like Naruoga.
I'm begging that this question is asked to the hospital administrator about Naruoga and whatever and her handwriting. Yes.
You said you dictated.
On to the ward doctor, because when you go to see a patient, you don't go alone. You go with the ward doctor.
That is understood, doctor. You've said you can't read it's faint because it's photocopied. The prosecution is suggesting that it looks like Naruoga. So does it or
I don't want to commit myself, Your
don't-
Honor.
yeah,
Yes,
that-
I cannot
that is
commit
what you
myself.
answered.
Yes, I pass.
Do you remember dictating to Dr. Naruoga?
I mean,
You did.
to a ward doctor. I remember dictating to a ward doctor.
My lord, my question is very... Unfortunately, my lord, if the witness is not willing to answer clear, straight questions, he can indicate so to court, and then we go to the next process. I have no instructions to exchange with the doctor, understand? My lord, I request that where the question is clear, let him provide clear answer. He's not an advocate for anyone here.
So, doctor, for your position is you cannot read the name at the bottom. You dictated. You can't. You're not expected to remember every doctor.
Even the doctors that I interact with,
Yes.
I cannot remember the exact doctor.
You are
at
not
that point.
expected to remember offhand.
And if
so
it-
the prosecution has stated that on their form they can read a name Naruoga. Can you read the name Naruoga on your form? If not, you say you can't. Let us project it. You project that page. Let us.
My lord, I thought it is easier if counsel can avail his copy to him.
Maybe it's clear.
Well, uh, in that case, since we got it from the defense as photocopies, we could also, use the defense copies.
Officers, what are you reading? There's what? You're reading what? So you're seeing D? You come closer. As an assessor, you need to satisfy this. What does it look like? The name after. It's faint, but what do you see? The assessors say that they see, although with some difficulty, the name Narug. So? Okay, proceed.
Is that all? Documents that you, now all the documents you have named,
Yes.
you wrote or dictated?
Yes. There are some that
Do
I'm...
you have any that you saw?
Yes, there are some that I could have seen, but because they're not clear, I cannot commit myself, like the X-ray. I saw a picture of an X-ray, but I need to see the clear picture. This picture is faint.
What else did you see?
I saw some other pictures.
In terms of, okay, pictures
Yeah,
are also
okay,
documents.
fine. They are also documents.
In terms of the documents given to you, do you remember seeing any other?
Okay, let me check again.
Yeah, you gave us three categories.
Maybe you can.
Wrote, dictated, saw.
Yeah. And then also I saw the notes of my colleague, because for me to add my notes, I don't repeat what he has like prescribed. So I can put a note on it.
Now, we are going to save on the time. Go to the beginning of the band of documents.
So,
Doctor, did you see the admission form for the patient? Yes or no?
yes, I should have seen it at that time, because I have to confirm that it's the patient I'm treating.
Just for clarity of record, you saw the assessment form, correct?
I should have seen it, because I have to confirm that this is the patient I'm treating, I'm going to treat. That's a requirement. You see it, and you should confirm that you are treating the patient. Sorry.
Did you see the initial notes, initial nursing notes, where the vitals of your patients were taken? Did you or you did not?
The role of...
Did you see the question is saying, my lord?
I cannot be sure about that.
Can you confirm that in medical practice, these clinical nursing notes are taken at the reception of the patient?
I can confirm that.
And among others, they guide the next action officer, the next physician, on as to what they are dealing with.
Especially the anesthesiologist who is going
They
to
guide the next action
process.
officers.
Yes, the emergency doctor, the anesthesiologist. Yes,
So
very
they guide-
important.
they guide the
They
next
guide the,
team
yes,
handling
yes,
the
handling the
patient.
patient. Yes, they guide a lot.
They guide the next team handling the patient.
Doctor, you earlier told this court that before theater, you have to ensure, among other things, that the blood is secured. Did you see the blood transfusion form,
Your Honor,
the file?
yes, let me answer that question
Did
very
you or
well.
you did not? Now, doctor, I am really very sorry, sir. Please,
And let me answer the question.
humbly request you to provide straight answers to this
I
court.
am being asked very detailed questions.
So, doctor,
Okay.
before
Before-
a patient,
yes.
before you take a patient
Yes,
to
to
theater, you ensure that there is blood secured.
The anesthetist has to...
No. What
can-
about you, the
Me?
doctor? Is
Yes,
it your
yes.
role to ensure?
No, it's the anesthetist's role. That's what I'm answering that one.
Let's first leave the anesthetist. You.
We are a team of doctors.
We are asking
Dr.
about you, Mr. Sechimpi. We want to leave things done
No,
by
just
other
a-
doctors.
I'm
no,
not
Mr.
concerned with the brain and the saturation of the patient, because there's an
Dr.
anesthesiologist.
Sechimpi, we're asking about, you did surgery,
Yes,
the orthopedic surgery.
yes.
Do you need, as an orthopedic surgeon, to ensure that blood is available?
Yes. And
So-
I get a report from the anesthetist that the patient is stable and is fit for surgery, because
So
he's the
what
expert.
about the issue of the blood? How do you ensure?
It's the anesthetist to make sure that the blood is available, and
So
he
it is-
usually assures me that
So in this case,
Yes.
the anesthetist
yes,
assured you
is the primary
that blood
yes.
there's blood
Yes.
available for your
Yes,
patient.
yes, because it's the primary person to be, giving anesthesia, resuscitating the patient as we work on our injuries.
Okay?
Those details are good, but certainly they are not the ones we need. Tell this court whether you saw or you did not see.
I cannot remember. It's 2.5 years ago, Your Honor. I will be lying in court. But I know that we get guarantees that the patient has been resuscitated and the blood is available. And the anesthetist cannot allow this patient to go to theater if all those issues are not addressed properly.
You are still
That's why
answering my question.
Yes.
My question
So
requires
that's how I can answer that question, Your Honor.
So you've said you cannot remember if you saw the form for blood.
For blood, yes. I don't look at those forms if the anesthetist has assured me blood is available, because they're the ones in charge of that and the emergency doctor.
Okay.
Yes.
The perioperative record is the one that you used in the theater.
The what?
Perioperative record, my lord,
Okay.
is the one that is supposed to be used in the theater, correct?
It is used in the theater.
Did you see it?
If you can't remember, you say.
I can't remember. I think we can move on to that next question. Yeah.
To cut it short,
Yeah,
if you
because
can't
it's-
remember, you say you can't
It's in the area of anesthesia, and once they assure me everything is fine, we go ahead.
So it's the job of the anesthetist to ensure
Yes.
that there is blood.
There's blood, the vitals are fine, and the patient will be stable throughout the operation.
Doctor, other than road traffic accident or car crash, as documented in those hospital documents, and I want to be sure that by hospital documents, I'm referring to those titled IHK.
Yes?
Is there any documented cause of injury of Mole Katanga, either that was recorded by your colleagues and you read it, or recorded by you personally?
Yes, there's a record that I made because I interacted with the patient for a while, and I came to know the exact cause of the injuries she had from her and the relatives.
I shall break my question into two. Let's begin from those written by your colleagues that you could have seen. Did you see any?
At the emergency.
Did you or you did not?
Yes, at the emergency I saw, because I scanned through quickly.
Take court
Yeah.
to the emergency that you saw.
Eh? Pardon, the identification of the patient, as I've
So
said.
what?
What was written at the emergency?
At the emergency, I want the identification of the patient and
Emergency
quickly
doctor, you're
scan.
referring to which form?
Patient emergency assessment form.
Patient
The one you yeah.
assessment form.
Yes.
This one,
W-
prostitution exhibit 103A. That one? Are you referring to that one?
This one?
I should
Yes,
have back my stickers, please. No,
Can
the
have his
stickers.
stickers.
Doctor, are you referring to that one?
Yes, because I have to know the patient's name and
No, no, no. I have not asked for those questions. Please save court to write what we don't need.
okay.
Yes. So, in this accident assessment form that you say you saw, is there any recorded cause of injury other than road traffic crash and car crash?
I'm just seeing road traffic crash
It's
and
you
car
that
crash.
told us.
Yes.
Yeah,
Yeah,
you
that's
just
what
said
I'm
that.
seeing on that form.
Okay, thank you, doctor. So, other than that form, in relation to the documents that you read, is there any other form that describes the cause of Mole Katanga's injuries?
The report I made.
No, I will come to that. I've decided to be orderly. Just go on record. Either there is another or there is none.
I'm not sure that is another or there is
To
none.
the best of your knowledge.
To the best of my knowledge.
Yes.
Yeah.
From the documents that you read, and most especially in the bundle provided by the defense before you, is there any other cause of Mole Katanga's injury that you saw or not? Provide a straight answer.
I have not seen another cause.
You've not seen.
Maybe I missed it. Because it's...
Now let's go to those that you say you wrote. Which one did you write?
I started with the consent.
Go to the ones that you wrote, eh?
Yeah.
Consent. Okay. This is patient consent to procedure or operation, correct?
Yeah. Yes.
Dated when? Is it dated?
Second of November.
What did you write? Read it as is to court.
So there's a patient. So you start with the patient identification,
No problem.
the patient number which you
We can
is
see Katanga.
delivered,
Mori. What did you write?
and then for you write the whatever
What did you
the
write?
diagnosis as you see it at that time.
What did
Fracture
you,
metacarpals and ulnar for pinning.
you wrote?
and
Let's
splitting.
go slow for
Yes.
the record, eh?
Yeah.
What did you write?
Fracture metacarpals plus ulnar for pinning plus splinting.
Please, doctor, I beg your pardon. Read it again for court.
Fracture metacarpals plus ulnar for pinning and splinting. That was what I wrote.
That's all you wrote.
Yes. That's what I wrote.
Okay. Any other form that you wrote? Remember, my question is on the cause of Mole Katanga's purported injuries. Do you have any other document? Under your hand at the hospital?
So then the theater notes.
Sorry, doctor.
We go to the theater notes.
The theater notes. The theater notes. When did you make these theater notes?
After
The date is not there. Does it indicate the date? Does your theater notes, are they dated?
it is the same day, 2nd of November.
My lord, the question is, are they dated? If they are dated, please show court the date.
The date is on the original page of theater notes.
Now I'm referring to you things which you wrote. Did you put the date?
But
Is there a date on that document?
on the
On that
original
page.
on the first page.
Now, doctor, I'm asking about the page where you wrote. My lord, the witness has been clear. He does not want to be asked about what other people did.
Can I
And we are fully complying.
answer your question, sir? Your
Please.
Honor, can I answer the question?
My question is,
Are
did you
there-
indicate
When we
the
are
date?
two surgeons, I write what my colleague
My lord,
has not written.
those are details. Now I'm asking you.
So
So
on your,
that's how I have answered the question.
on your notes,
Yes.
on your
On my
theatre
extension,
notes,
yes, notes. Because
so
the extension of the
question
theater
is-
notes.
So the answer is that on your theatre notes, there are no, you didn't put a date.
Even the name is not put the name of the patient because it's already recorded on the original page theater notes. This is an extension because you see the reason why I'm writing on this one is because this one has been filled by my colleague.
Okay, so you followed from your colleague.
Yes.
Now that you extend it to your colleague, I want you to tell this court, from what your colleague wrote and from what you wrote personally, is there any other cause of More Katanga's injury other than the one that we have traversed?
Yes.
Contract accident.
Yes.
Let's begin with yours.
Mine.
Show court where you indicate the cause of injuries.
Okay. I don't,
Are we now on the theatre notes?
Yes, my lord.
theater notes don't have to have the cause.
That's why this
It's
court,
not a must that
this
they should have
court has
cause.
advised you, if they are not there, say it's not there. Then we go.
But you were clarified by Lord that are you talking about theater notes because you said you were just asking a general question
So on the
until you
theatre-
clarified it. On the theater notes, yes.
You wrote
We
a
write
cause.
about the operation.
I'm now asking about cause, doctor.
It is not part of the theater notes, Your Honor.
It's not.
Yeah. Because it has
it's
already
not-
been
please.
alluded to earlier.
Oh, it has already been
Yeah,
alluded
yeah,
to
by the
earlier
margin.
as road traffic accident. Correct? So, yours, there is nothing. Confirm to court that even your colleagues, Dr. Nens, that you followed.
It is
there
not part
nothing.
of the procedure of court to write the cause. You don't write all the details in the
It's
theater notes.
It's okay, doctor.
Yeah.
I just want you to say.
The cause is
it
written in the
there
patient
or
notes,
it's not there.
not in the theater. So it's not there.
So
It's not
what
there.
I've recorded is the cause of injury is not part of the
Yes.
theatre notes because it's already been alluded to earlier
Yes.
in the patient notes.
Patient's notes.
Okay. Is there any other document? Let's finish all the documents so that this court can be sure that we have exhausted
So
IHK documents
I
on
take-
what they were dealing with.
I take you to my report,
Which report?
A1.
Report to who? Report to?
From the request of the police surgeon.
Report to the police surgeon.
Yes.
I will come to that
After-
report.
Yes.
That's an external report, and I promise I'm coming.
It's
to
not
it.
external. It's a report of what I did.
Now, at this stage, my lord, I'm dealing with the clinical notes of the hospital. I will now come to what you told other people outside. Let's exhaust the patient's file. This report is not a patient file. Is there any document in your patient's file
Your,
that speaks
Your
to the
Honor,
cause of injury different from what we have told court?
I cannot be sure about whether that record is in the
There or
hospital
not?
or not. Yes, the administrator of the hospital will confirm that.
Fair enough. Now, as far as you are concerned, you, Dr. Sechimpi, did you make any clinical notes other than speaking to anything relating to cause of injuries other than what we have said?
It is the same answer I'll give you.
Which answer is? It is.
I cannot confirm what
can't
you are
confirm.
asking because it's a while, really. It's a while.
Now, go to the admission form, which you say you saw. That you use the court copy so that court knows that we are getting it from what's already on record. Doctor, what does HTN stand for in medical terms?
That should be hypertension.
HTN.
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 Stands for
Wait, that should be, I think, hypertension.
hypertension. So in medical terms, when a patient is presented and you write known HTN, what does that mean
She's a known hypertensive patient.
at the time of presentation?
Yes.
Okay, thank you. Now, doctor, from your perioperative notes, if you like, you may go there. The one you say you co-authored with Dr. Onen. My Lord, just a minute. I want you to go to page 2.
Page 2 of
The perioperative notes.
Mr. Mwaganya, page 2.
Of the perioperative notes, perioperative record. My Lord, this is the record he says he co-authored with his colleague, Dr. Onen, theater, for purposes of theater.
No, my lord.
I think you are really putting.
Yeah, exactly.
That's not true,
That's
Your
not
Honor.
true, my lord. He never said that. He
I
only
never said
referred at the last. So
At
this
the
one
last,
is
yeah.
actually by the anesthetist, even if you look at it. So he didn't say that.
My Lord, hasn't he just said that?
Yes,
he
I
did
wrote
not
the
put
theater
names
notes.
or
I co-authored the
Dr.
theater notes because I did it.
Yeah, she has just said
Theater notes, not the
Theater notes.
Yes, theater notes. Not perioperative.
he has just told
Preoperative. Preoperative is by
you,
anesthetist.
don't participate in this, please.
The
Wait
only
for questions.
preoperative document I wrote on is the
Doctor,
consent.
Please wait for the questions from the state.
From my Lord, from our understanding, the doctor has just told this court, his notes did not have his names, he did not have the date, or
Whose
the
names?
name of the name of the patient. And the reason given is that these are already captured.
No, my lord, that's not true. The witness said that the document did not have the patient's name. It had his name.
Okay, let's-
and what he
my
said,
lord, I can
my
do it
lord,
another way
and
around.
what he said is that if you look at the page written by Dr. Nen, that's where you have the patient's, that's where you have the date.
That's okay.
So he said, and even before as he was looking through them,
That's okay,
he said
Mr.
he doesn't know the rest of the
Karumanga. Let's
perioperative,
proceed.
except he knows the notes of Dr. Nen and his notes.
That's okay, Mr.
Let's
Karumanga.
proceed.
So, doctor, why didn't you indicate your name?
It's shown.
On your-
Look at the upper part.
Great. The upper part is page 2.
On page 15?
The upper part of,
Yes.
of,
Of the theater notes.
of the theater notes.
Yes, I wrote.
Okay, great.
So we are at page 15.
Yes.
So page 15 has your name.
Yes. Signature.
Why don't your notes bear the patient's name?
The name is on the first page of the theater notes.
On the first page of the theater
notes.
which
So-
is page,
Which is written, I think should be 14.
I don't know,
Yes,
look at it
before.
before you.
So the name of the patient is on the first page
Yes.
of the theater notes.
The theater notes, this one written by Dr. Nen, should be there.
Please look at it. Doctor, do you see any name of the patient on that page you are referring to?
Okay.
Is it there? If it's there, help this court and we move.
Anyway, that was something I assumed.
And
But it's a book. It's a booklet. I wish you can get that booklet.
Is the name there on that part?
Okay, Your Honor, there is a booklet in the theater.
Dr. Sechimpi, is the name there?
Yes. Can I?
First answer.
Yes.
Is the
Let me
name,
let me answer.
is the name there on that part? The name of the patient?
The
Dr. Sechimpi, is the name
no,
there?
here
or
on this is theater notes. Here
yes, on the theater note.
on the
Is it there
real
or
theater
not?
no, it's not there.
Yes.
And I will explain why it's not there. It's because it's
Doctor, you
the booklet.
wait for questions. My Lord, I'm going to apply because the law gives us an option for a witness of his kind who is not willing to answer questions.
No, Mr. Mwaganya, let's proceed.
Don't intimidate me.
Yeah, because my Lord, I can only do what
intimidate.
the law allows us.
No, don't intimidate me,
No,
please.
I'm not
Doctor.
intimidating you.
That's wrong.
I'm not.
Doctor,
I'm here to just tell you the truth.
Doctor, calm down. Answer the questions as they are asked to you.
Yes.
If there is need for clarification,
Yes.
it will be done in re-examination.
Okay.
So that we move quickly.
All right.
Because
Let's
it's
proceed.
already 11 and we've spent a lot of time on back and forth. Just answer, take down the notes, you will re-examine so that we conclude.
So, again, back to the question, why is the patient's name not on your notes? Because you were referring it to a page, assuming that it is not. But it is not.
Your Honor, the theater operation notes is a booklet. You start with the pre-operative period where the anesthetist fills most of that information, including all the details of the patient. By the time you reach the end surgeons, for us, we're just writing what we've done because everything is detailed. And it's a booklet. I wish the administrator can bring it here. These are photocopies, but it's a whole booklet. And it's only when the page is full, that's when you add some more pages.
Can I have your book, please? That bundle? Officer, please.
So there is a booklet.
A booklet, yes.
So the anesthetist fills in the details of the patient and everything. And when the surgeons come in, they only write what they did.
Yes. That's why even they don't put name. But in some theaters, they do it different. In other theaters, where they don't have booklets. But this one is a booklet form.
Actually, that is exactly what we were saying. So the reason you did not include the patient's name in your own notes is because the particulars of the patient you are dealing with were already filled on the booklet, correct?
Yes, sir.
This is the booklet. Please look at it.
Mr. Ayo,
My Lord, these are defense documents.
do you want to see it? Mr. Ayo, please give them the booklet. Don't.
That the booklet you are referring to? Yes. And you see that both your name and that of Dr. Sachimpi, Dr. Nen, are indicated. as surgeons, correct? Correct, please switch on the microphone there.
Yeah, they are indicated.
Okay. Even your client's particulars, in terms of names.
Yes.
Katanga, Moli, correct?
Yes.
And as a doctor, to work on a patient, obviously you have to inspect this booklet and ensure that you are writing in the right booklet for the patient, correct?
Yes, I have to ensure that the name is the one on the booklet.
Can you read to court what is under patient's history and examination?
My Lord, if that isn't written by him,
My Lord,
No,
can Mr.
but that is
Karuhanga
the
allow
booklet.
us to cross-examine?
That is a booklet he says he used. It was part of the document.
Surely, a lawyer cannot be seen to over.
Which page are you referring to?
he needs to stop accusing me. I've really been quiet. He needs, the tactic of accusing me, he needs to
Let us
stop. My Lord, you
proceed.
need to restrain him from personal attacks. I've let you cross-examine. I haven't objected.
Okay,
Imagine
then
you
sit
were the
down
one
and
listening.
we
Imagine you were
continue.
the one listening, how many times you would have stood. I've really been patient with him. But every time I stand, he decides to do a personal insult. My Lord, he should desist
Lord, there is
from
no
insulting
insult
us.
here, my Lord.
He should
I
desist from calling.
I didn't hear the
He
insult.
said, he said it's unethical, the practice of a lawyer blocking evidence, the practice of a lawyer blocking evidence. My Lord, let him stop insulting us. We don't come here to be insulted. We're officers of court.
Mr. Karuhanga, your discomfort with his language is noted. Mr. Mwaganya, please restrain yourself. Let us all restrain ourselves so that we move. See the time we have spent. Let us, Mr. Mwaganya, please proceed. No, Mr. Mwaganya, proceed.
Okay, doctor, please read to court. Read to court what is written under patient's history.
So the doctor wrote
Yes.
deep cut scalp wounds following RTA,
I
known
just request you to
hypertension.
read it as is, then we shall progress.
I don't know whether we're on the same page.
It's page 2, under
Page two,
patient's
yes.
history. Page 2
Yes.
of the form.
Yes.
Yes. Just read it as is, then we shall ask you to explain if we need.
Okay.
I see it begins with TBI or something. Please read.
Okay. TBI.
What is TBI?
Now,
The
that's where-
neurosurgeon will probably will be better, or the person
As a
who
doctor,
or the
do-
anesthesia.
what does
What I
TBI
can think,
ordinarily
you know,
mean?
doctors we abbreviate a lot.
Yes.
So this could be traumatic brain injury or something like that.
Okay.
That's what I'm thinking. I'm just thinking. I'm an
Ordinarily-
orthopedic surgeon. Ordinarily, if I
Ordinary
see TBI,
TBI would be traumatic brain injury.
I'm just assuming also
You're a
because
doctor.
I'm a
Give-
doctor, but this is not.
advise us.
These are abbreviations. They're not part. Some of them are not very,
Okay.
common. Yeah, in my area of specialty.
Okay.
Yes.
All right.
Yeah.
Okay,
but
just
it's fine.
just read
What
it
I
as
can,
is.
whatever. Then that sign means with. That sign is a C and
See?
that sign which is like a C. The next whatever.
TBI with what? My Lord, I don't trust his documents. I want to be honest. You have not been fair to us as well. Let court use our documents, and,
Okay,
and
it's
please
C
don't
with
participate.
It's C and a dot on top.
Yes, and deep cut scalp wounds following road traffic accident.
Just a moment. It is a C with a dash, which indicates
With
a dash.
it indicates with.
yes.
It means with.
okay.
Okay.
The dash, deep cut scalp wounds following RTA and the known
And you say RTA is
HTN.
same question. You say RTA, it means what?
Road traffic accident.
Traffic accident,
With HTN.
and is
Hypertension.
known what? Please read it.
Hypertensive.
Known hypertensive. Doctor, confirm this was on the 2nd November 2023.
This document I cannot say.
Is it
What
dated
is written
second?
there?
What is written here? You refer me to the
That's the
date.
booklet.
Yeah, this is the booklet I'm reading. I'm reading things from here.
Is it the,
at
that's
it.
the booklet?
Yeah, it is
So
second,
what-
2nd November,
Which year?
2023.
So, doctor, the question is, for a real, genuine patient of traffic accident, it would be standard practice before operation for you to ascertain the following things. Number one, and please confirm if it would be prudent to first ascertain before operation blood level of the patient.
It is prudent, Your Honor.
And it is indicated actually on page 2 as a requirement, correct? Among the investigations to be undertaken, correct?
Yes.
As number 1.
Okay.
It would also be prudent to do a chest x-ray, correct?
It's not always,
Road traffic accident
yes.
before
It's,
theater.
it depends on the assessment of the,
Depends on the
of the,
assessment.
yeah, of the
But
team.
confirm to court that among the imaging requirements indicated on the form is CXR,
The-
which stands for chest x-ray. Correct?
Now,
On the,
My
on
lord.
the, on the,
let me explain this.
Just a
form.
moment.
Can I say
So
something?
you will
No,
explain.
you will explain.
On the form, let's first
Yes.
write what is the form requires, then
But-
we shall.
yes.
So on the
For
form,
you circle. You see, these are put there, and you
Okay.
circle what is
Okay,
relevant.
okay.
okay.
So that's what I'm trying to explain to
Okay.
him.
On the form,
They are there,
is,
so you circle what is
there is
relevant.
the requirement for a chest X-ray, but you circle what is relevant.
What is relevant?
That's okay. Would it be prudent to do a CT scan, especially where alleged fractures are involved?
No,
It is not
it's not
required.
prudent.
And you didn't circle. Did you circle CT?
No, it was not necessary.
It was not necessary.
Yeah, the injuries were clear.
That's okay.
When you say CT, you have attached anatomical part. CT brain,
So now,
CT.
to which question
So-
are you providing those
No,
answers?
I'm trying to
Please don't educate me.
Yeah. So the
Answer my
CT of the
question.
fractures was not necessary. The CT of the brain was necessary, maybe. The neurosurgeon will answer that.
Yeah, but please,
Doctor.
just
So I
answer
didn't
what
want to be quoted off. Yeah.
It is not your duty. Your
not my duty,
lawyers
that's-
are here. They have time
Yeah.
even to re-examine you.
Let's proceed.
Doctor,
Yeah.
you proceed. Mr. Mwaganya, next question.
Would it be prudent to do ultrasound?
If you suspect visceral injuries, that is injuries in the abdomen.
In the in the stomach. Okay. And
In the abdomen, not stomach.
whatever it is.
When you suspect visceral injuries, you do what?
You can do an ultrasound.
Ultrasound.
And ultrasound is abbreviated on your form as US.
US.
Did you circle it? No.
It's not my
No,
role.
it was not necessary.
In this team,
Was
it's
it
not my
necessary?
role.
In this case.
In this case, it was not necessary, probably. I don't know. Because I managed the orthopedic.
So in this case, it may not have been necessary.
Necessary, yes. That's.
Now, doctor, on the blood transfusion form that we have and were provided by the defense, they indicated that blood was released or availed at 10 minutes past 1 o'clock on the 2nd November 2023. True or false?
I cannot prove that fact to certainty. The anesthetist will be better positioned.
And I also take it that you actually don't know whether or not blood was available in theater when you claim to have worked.
Just a moment.
Yes.
According to what form is that?
My Lord, the blood transfusion services form,
It's on page 8. Huh?
page 9.
Okay. What was the next question?
My next question was, can this court also take it that you can't confirm whether actually blood was availed in theater when you purport to have, you claim to have worked on More Katanga?
The patient had bled significantly, Your Honor, and blood was available, and it was given to the patient.
Do you know when blood was availed?
It was several pints of blood, Your Honor. Here I'm seeing one form, but it was several pints of blood. That's what I'm sure about as a surgeon.
Doctor, where is that indicated in your record? That you've just told
It's
me?
not my role to indicate that.
Is it okay?
It's
I
the
can ask you
anesthesiologist's
this.
role
Is it
to handle matters
indicated-
of blood.
Is it indicated in your record or not?
I don't know. The Spirit Administration will avail that evidence. But I may remember what I saw.
Doctor,
What are you saying that you do not know whether the record of the pints of blood was recorded?
It is not my role to ensure that the record of the pint of blood is,
now we shall
is in
ask
this
my
set.
Lord about that.
So, because there's a team that is handling that part.
Doctor.
So,
Doctor,
2.5 years asking me about
Doctor?
those records
Doctor.
It's not me that
in out of my field
Doctor.
is really, I cannot really give you all the.
Doctor, you calm down, and let's go step by step. You said that the fact of the pint of blood, you cannot remember whether they're in your record, or it is not part. It's not supposed to be part of your record.
It's not a record that I'm supposed to take care of, you know, because I know that the anesthetic team is doing the right thing, and for me, what I saw is that pints of blood were given to the patient. So the details of when and how, those are now can be answered by the other team, the anesthetist team.
Now let's come to what you claim to have done. You told this court details of how you cleaned More Katanga's hands with the chemicals that you mentioned already on record. Doctor, where is that indicated in your record?
I don't record all the details of the chemicals. It's a routine procedure of theater.
So is it indicated
yes.
anywhere or not in the record? That's simpler.
I'm not sure.
You are not sure.
The term we use is...
Let's be specific to things which you wrote. Did you write that information anywhere as a doctor?
Your Honor,
Did
I
you
beg,
or you did
I
not?
beg to be protected. I'm a 23-year in service as an orthopedic surgeon.
My lord.
I cannot go to theater and unscrubbed, and I cannot work on a patient that I have not
Doctor,
scrubbed.
We have not, as we are not.
Yeah, so, and I don't have to,
33
to write that I put on scrubs.
Mr.
I did
Do-
this.
Dr. Sechimbi,
Those details will be
Dr.
a
Sechimbi,
lot.
please. You ask what you answer what you ask.
So it's not, if
Do
it's not in the
assume-
record,
do
I didn't
assume-
record
do
it.
not assume that court also has 23 years. Answer the question.
Yeah, it's because I feel
No one
like
is-
my
no one-
professional is being challenged.
you're
Like I
you're
just go to
answering-
theater and,
You're answering questions for court. We are not testing you.
yeah, that's
or-
why,
or
the way
putting
I'm
your
feeling now.
Professionalism under scrutiny. We need to understand.
Yeah,
And
I
make your-
explained exactly what we do as a surgeons. When we come to theater, we change clothes
That's
in the
not
changing
what
room.
I'm asking.
Now you want me to give you the details.
No, I
Dr.
don't
Sechimbi,
require
you
that
will
detail.
You will give the
I
details.
don't.
Then
that
if you don't want the details,
you will answer the details that you requested.
Yeah.
Dr. Sechimbi.
okay, all right, let's proceed.
Did you, as Dr. Chimpi, document what you told the court that you cleaned Mole Katanga's hands and all of that information? Did you or you did not?
I didn't document all the information.
That's sufficient.
Yeah.
Doctor, you told this court that your operations were handled distinctively. Yours from Dr. Onen's. Did we understand you right?
The operations were, we did the operations in series.
In series.
In series, but I was in theater.
Since you were in theater during the operation, the alleged operation of Dr. Sechimpi, of Dr. Onen, did you see?
Yes, I saw.
Wait for the question.
But you asked a question, sir. I was answering the question you asked.
He was still finding the question.
Did you see any open skull fracture on Morris Katanga?
I saw scalp wounds.
Now I'm asking about, my lord, I request that this court should not be led into writing answers separate from.
No, I'm waiting
other
for the
question.
answer.
Did you
Did
see,
you
my
see-
question is, did you see any open skull fracture?
Open skull fracture. Your Honor, that question is
Did you see?
very interesting. Let me answer it.
My lord,
You tell court
Let me
what-
answer it.
Tell court
It's
what-
not allowing me to answer the question.
Answer.
Do you want me to answer the question?
answer.
The patient is bleeding, and there are several scalp lacerations that my colleague is repairing. The bone is under the scalp, and there's blood also. So how can you be sure that this part of the skull was broken? That is the bone inside, because that's what he's asking. So what
So
I
we
saw,
take it that you saw.
My lord,
The
I don't
lacerations.
want court
You
to
did not
assume.
see.
I want
No,
the
no,
court
but
to
that is
provide
what
answers.
he's.
That's what
that
I'm
is what
answering.
he's
No,
saying.
my lord.
Okay. What did you
This
see?
court has prevented me from making
I
an
saw
application.
lacerations
My lord, I cannot
on the scalp.
be of help to this court if the witness deliberately chooses to be evasive to straight, clear questions.
What did
I
you
saw,
see?
I saw lacerations, several of them on the
I will
scalp.
ask you about lacerations, doctor. Now I'm asking about presence of open skull fracture. Did you see it or you did not?
I didn't see it. I didn't see it.
If anybody says that that lady had open skull fracture, would that person be telling the truth? We are dealing now with you as an eyewitness.
Your Honor,
Would the person be telling the truth, my lord?
the neurosurgeon will answer that question.
No, now I'm dealing with
Because
you.
that's
I
his
never
area.
invited you here. You
Okay.
are the one who has told this court.
Yes.
You were there, you saw by your
It
eyes.
means me to scrub
Let me
and do
test
this
what
and
you
see.
saw.
But if I'm seeing from the theater, before I scrub in to go and participate, I was not assisting the neurosurgeon to see the details of what is inside the wounds. I saw the lacerations because you can see them from a distance before even whatever, you know, scrubbing and putting on the whatever theater
So
gowns.
you were in the theater?
Yes, waiting
But
for him
you were
to.
you were at a
yes,
distance.
yes, to see how things are going before I.
So if somebody came and,
And preparing for
said
my
they
things.
saw open skull fractures, would
They
be
will
right?
they will defend that.
Would they be telling the truth? It is now you.
It's not me
understand.
to answer that question of whether they're telling the truth.
My lord,
Because
you realize
that's-
I can't progress. I
Dr.
can't, and
Sechimpi.
I want to concede, my
Dr.
lord.
Sechimpi's response to this question, you asked whether if someone came to court and said he saw open skull fractures, whether that person would be correct. Dr. Sechimpi said that he was in the theater, he was watching from afar.
Yeah.
So what is the answer?
My lord, the answer is that that person would defend it. I have recorded. My lord, he answered, he said that person would defend his answer. That's
He will
the
defend
answer.
his answer.
You answer, what?
Let him defend his answer if he saw the details of what is inside the bone and the brain. Me, I saw the lacerations on the you know, on the skull.
Fractures. So from the point where you were, all
Yes.
you saw were lacerations.
Yes, I saw lacerations on the skull.
Doctor, the reason I ask you this question for court is because we have instructions that medical officers of IHK fabricated documents in respect of Mole Katanga to make up a scenario. Okay?
Okay.
So,
No,
He's
he's
putting it to
still-
me. Yeah, it's okay. I appreciate his opinion.
He's
Yeah,
going to
it's an
come to the
opinion.
question.
Yes.
He is,
So ask the question. Yeah.
no. He said he has instructions that documents were fabricated. So he is now, that is not, is that the question?
You can't just make that statement and move to something else. That becomes testimony.
He
if
had not finished.
if he hadn't interrupted, I would be
Yeah,
far.
he hadn't finished.
I don't know why my colleague is anxious.
Mr.
In your documents of IHK,
IHK documents.
do you not belong to IHK?
Yes, I'm a consultant there.
Yeah, of course. So in your documents, you have severally, but when I say you, it's not personal, you as the institution, indicated that you were dealing with a patient with open skull fractures. Not in one document, not in two. Doctor, you are such a fine professional, I want to believe. whether you worked on this lady personally on the scalp or not. Do you believe that the patient you were dealing with had this type of injuries?
Yes, I believe that the patient had scalp lacerations.
Not,
Now, with the part of the fractures, I'm not sure.
You are not
the
sure.
neurosurgeon will
Fair enough.
will have his day to answer that.
Fair.
Because that's deep. Yeah. That is a deeper structure. So he's the one who analyzed there when he was stitching.
But as a medical doctor, when you make reference to open skull fractures, you are referring to a situation where the skull bone is broken. The scalp is broken.
The scalp is different from the skull.
The skull bone. I beg your pardon.
But I'm saying the scalp is different from the skull.
Forget about that. Now deal with the skull.
So what are open scalp fractures?
Now, a scalp is the soft tissue.
It cannot, can a scalp fracture?
And then a skull, a scalp is a wound. It is a laceration.
I'm not asking about scalp.
No, I want to. Oh,
Are
so
you asking about scalp?
What did I write?
My lord,
Did you say
skull.
open skull or open scalp?
Open skull.
Okay.
Skull.
My lord, did who say? My lord, the witness said
No,
open
he
scalp.
asked. I wrote a question. I wrote an answer in relation to what he asked.
Yes.
I thought he had asked the
Scalp.
witness whether the witness saw open scalp
No.
fractures.
Skull.
That is what
Skull.
I wrote.
SKULL, my lord.
Okay.
Skull.
Okay.
Thank you.
Continue.
Open skull. Okay.
Yes.
Thank you. So if someone came to court and said that I had seen open skull fractures, that person would need to defend the fractures.
position.
Me, I saw
Scalp
lacerations.
lacerations,
Okay.
yes.
For you, you saw scalp.
Scalp laceration.
Thank you.
Lacerations. Okay.
Thank you for that clarification. Okay, proceed, Mr. Mwaganya. The just a minute. Scan. Okay. Said- Yes, okay. If that person, okay, all right. Thank you. No, he's clarifying. Mhm. Thank you, Mr. Tumwebaze. I've benefited.
I'm waiting for
from your
Mr. Tumwebaze.
clarification.
Okay. Nti niwe omulwaire owayina kandi mbihandikirwe hali omulwaire ono ebingi bingi kandi oleka nti ayinaho obulwaire obukumutalibaniza kandi omu bihandiiko ebyo kiketegerezebwa nti haliho ebyakozerwe bayita ebikiro bwingi bitahandikibwe kandi nti omusaayi gugambirwa ogwaturukiibwe essaaha 7:10 takimanyire nti nibo bwobwire baite ekyakumanya kandi ekyakwikiriza nti omusaayi gukabayo kandi omulwaire gukamuheebwa bwokuba akaba ajwire omusaayi guli mwingi muno. Ebintu bino byebakozere bakandi nibabikora kimu hali kimu kandi omusika kino ekikebererwamu we nk'omuntu atalole eigufa ericwekere kandi takusobola kutugumiza nti mazimako litabemu.
Doctor, I know that professionally, you can't operate to somebody, you can't operate on somebody who has not consented or on whose behalf consent has not been secured. Am I correct?
You're correct.
Who consented to yours said operation on Mole Katanga?
We explained to the patient, Your Honor, and the
My lord,
relatives
when I
was
asked
there.
you who, I required the name of the person. Can you be kind enough to disclose?
I will need to go and
provide
check
the
on
name?
check the exact records.
You
Can't
have-
remember.
You can't remember.
I mean, those are very, very detailed
It's okay,
issues.
doctor. I don't know. Please don't find it hard. If you don't remember, it's
Yeah, I don't
perfect.
remember.
Okay. Please refresh your mind because the theater documents are before you. Theater documents are before you. Can you refresh your mind with your own theater documents? My lord, can the witness do so?
That's what he's doing.
Okay, perfect.
So,
I hope you are in the perioperative record, your theater handbook.
so maybe what I will say what I remember. I remember that the patient.
Please, court has given you an opportunity to
an
make
opportunity to
reference.
make-
Let's first
So from
speak
the
to the
documents.
documents.
So,
From
yes.
the
Is
documents.
it there from the documents?
From the documents, it
Who
is
authorized or consented?
who considered for the surgery.
Let's begin with the perioperative record, which is the theater handbook.
Okay.
Record.
So in the records of the hospital, the
No,
person
which
who
one, specifically which one?
who signed, that is, if you go to
Doctor,
page 3, go to page 3.
Page 3 of
Of
which
this document.
document?
Page 3 of what?
Of this document.
Page 3 of what?
Is it the perioperative? Is it the theater booklet?
This is the pre-operative whatever notes. So
No. Which one? My lord wants to know which document. Is it the preoperative record or you are referring to another document? Which document is that?
give me time, please.
Okay, no problem, doctor.
Let me just look at the documents clear. So there are two documents in consent. One is filled by the nurses, okay? And then you come and explain to the patient and the attendant what you're going to do, and they accept, and then you sign the document on what procedure you're going to do, and exactly what, and then you put there your what? Your signature. That's the consent that I see.
Do you still remember our question?
Yeah. So from the records, I see Patricia.
From which record? Mention the document.
Person who was the patient in the record is
from
Patricia.
which record, my lord?
Patricia Kabaranzi?
Kakwanzi, but from which record? No problem.
Yeah, that's the person who was.
So which document is that?
Which document?
This is document number 3.
Which
the
is
daughter.
titled what?
Okay. That is the person I see in the records.
What is?
And then the other person I remember.
Just a moment. The document is titled what?
Okay, this is the patient's admission.
Admission
and
form.
whatever. Yeah.
Patient's
Admission
form
form. So
indicates Patricia as the person who gave consent.
Patricia Kakwanzi as the person who gave the consent.
As the person.
Doctor, at what time is indicated?
Person who gave consent.
You know.
Just a moment, doctor. It indicates Patricia as the person who gave consent.
The one who was in charge of the patient was Patricia Kakwanzi.
No.
So what I'm trying to,
Doctor,
and I want to answer that question very honestly.
Doctor, according to that patient's admission form,
It is Patricia.
Patricia is indicated as the person who gave consent.
Said to
Finish.
treat the patient.
What time? Okay, maybe what relationship did she indicate?
She's a relative. Now,
look at the document.
Doctor.
Doctor, what time? Okay, what date first?
2nd
Of
November 2023,
what time?
9:25 a.m.
9:25 a.m. Now, you are a medical doctor, and you've just made reference to an admission form. In your understanding, was this consent for admission or for operation?
It is the consent for treatment, and I mean that's the record I see here. But I imagine maybe there's a page that the administrator will give.
We don't want you
to that
to
effect.
add
That consent was
from
for
the
what?
admission
Was
form
it for the operation
or for admission.
or for?
This is for admission,
Admission.
and treatment
Thank
of
you.
the patient.
Now let's go to. Sorry.
Oh, just a moment. Luzira is off.
Oh.
Oh.
Luzira went off. This time it's not us. We are going to be roasted if it was us.
I mean,
Someone was now anxiously waiting to pounce on court. Power is off in this. Lucida is off.
Lucida is off.
They have suffered the power cut. This time it's not court. I don't know. I am not in Lucida. I don't know. Mr. Morgan, Lucida can't have power cut. It is a security issue. What experience does Mr. Kabega have with Lucida?
So, doctor, this court now knows who consented to the admission and at what time. 9:25.
25, yes.
Perfect. Take this court to who consented to the operation. that purported operation.
But because of the fact that that record is missing, maybe the administrator of the hospital will address that.
Okay.
In this evidence I'm being given.
Doctor, is it not your ethical duty as a surgeon that before you carry out any operation, legal consent must be secured?
It is true, and it was secured, but those details, the administrator of the hospital will avail the reason why maybe that area is not here, or maybe he has the original copies. I beg that it's transferred to the administrator of the hospital. Because for me,
Doctor, this professional duty for consent, is it on the administrator or on the surgeon undertaking the procedure?
He is the one in charge of records. And consent, yes, consent is it's a whole procedure. The nurse has some consent she takes.
My question is
the neurosurgeon has some consent he takes.
You as the orthopedic.
And me as an orthopedic,
yes.
I come to my page,
Yes.
I write the patient's name, after talking to them that this is what I'm going to do, and they have accepted, and then I sign on my part.
So assuming someone is operated without consent and something happens, in the hospital, who is held responsible?
Is it
if I didn't sign here, I would be responsible.
So it is you
so
who
who
is
gave you
responsible.
consent?
The patient and the attendants.
Sorry, my lord.
And we get consent from two people. If the patient is cautious, she accepts that we do the operation. If she's probably unwell, the relative consents to that, whatever. So those details now, after 2.5 years, you may be lying to be very sure, because I was not interested in the case.
If consent is not obtained and something happens to the patient,
Yes.
who is held responsible?
Both the doctor and the hospital.
And the hospital.
Yes.
So the doctor must ensure
Yes, that is signed.
that the consent was obtained.
Yes, to do this operation. That's why we signed this form, this part of our form. But there's another part, I think, that the administrator can avail.
Doctor, this court is interrogating a very serious issue, as you may know. And I already put to you our instructions. Now, I'm coming, please, counsel. Is it your position that since it's 2.5 years ago, at the moment, you cannot recollect whether you obtained consent before operating, before that purported
I can recollect.
If you can listen.
All right. I came in contact with the patient and the relatives, and I told them what I'm going to do. That's what we do as surgeons. And when they say it's okay, we go ahead. You come and sign the procedure you've explained to them, and what you're going to do, and you sign it.
Doctor, do you have where they signed? Do you have, if this operation
on this form, there's no place for the patient, but there's a place where the patient or the relative signs.
Where?
And I refer to the administrator of the hospital to provide it.
Usually, where is that?
It is in the file of the patient. Usually there's that part where they have to consent. Yes. So I'm requesting that the administrator avails that part. So if it was not availed, it's not my responsibility.
You are requesting that the administrator accesses you that part.
He should access. He should bring it to court when his time comes.
It is you, the surgeon. Please, it is you who is a witness, sir.
So for you.
So if I cannot access it,
doctor, I need to record.
Yes.
As far as you're concerned, you obtained that consent.
Yes, I obtained consent.
In writing.
Yes, that's why I signed this form. What I'm going to do, and then I sign it.
Doctor, look at the pre-operative record. And go to page 4. Section 2.
Page 4, section 2.
Page 4.
Do you see the requirement of
Is this one?
sorry? No, this one.
Page 4. Page what?
Page 4. With the pre-operative record. You can use this. This more. Doctor, please use this. Confirm that section 2 requires consent of the patient, and it provides for.
It is true. It requires consent of the patient.
Was it signed?
The nurse has to ensure that it's signed also.
Just section 2 requires consent, and it is the nurse.
Yes.
Where is it written that it's the nurse and not the surgeon?
I'm telling you what we do.
It is the nurse to
Yeah.
ensure
By the
that
time you
this-
come to the surgeon, me, I'm
Just
just
a
signing my
moment.
part.
It is the nurse to ensure that this
The
consent.
patient has consented and signed to the,
been
yes, or the
obtained.
attendant. Yeah. So you are asking me questions which are administrative, which the administration should answer actually.
This is the one
I don't know
titled
that-
anesthesia consent note.
Not, and I see it's empty. I'm even also surprised as you are because it should be filled and whatever. So I don't know whether this is, me, my part, I told you, me what I did is what I did.
Now, as you as the doctor,
And I'm being, I'm supposed, yes, I'm supposed.
Are you supposed to ensure that before you proceed,
Yes,
that
it-
detail is captured there,
This,
where it is provided for consent of patient or attendant?
so this is a blank form, Your Honor. So I am also surprised that it's blank. So I'm requesting that the administrator answers why this is blank.
It is blank
Not-
because
not-
no such procedure ever took place.
Because there could be one which was signed and maybe, I don't know. So he should really bring those records. I think you're asking me questions about records which
So,
I don't
no,
keep up.
The question is not about records. The question is about what you did. Now,
Yeah, I got,
for you, you're saying that you
yes.
you
yes.
ensured that the
The
consent
operation, yes,
was
apart
obtained.
from the patient. And that's, after that you,
It is the document you have been given is part of the booklet that you should have looked at before the procedure. Now,
Usu-
that part is not
So-
signed. And you're saying that it is the nurse who should have ensured that this consent has
yes,
been obtained.
yes.
But now you, who is going to be liable if anything happens,
Yeah.
what is your part?
my part is to come and explain to the patient and relatives, I'm going to do this operation, blah, blah, and then these are the expected outcomes, and then they say, doctor, go ahead. Together with the other people who are going to work on the patient.
So
And
on
then
that-
when they accept, that's when I write and what? And sign.
So now on that
And then I
part,
enter theater.
on-
So
on
this
that
one,
one,
I'm
yes.
requesting that the hospital addresses that question. Why this, they gave the court this, because I don't know even where the records were gotten from, because me, I did my part. So I don't know whether they made a mistake or what, but it's not something I can prove to this
so
court.
you're saying that you, in the file, initially, you've signed.
And
The patients
should have,
The patients-
attendant should have signed somewhere for that operation. That's what I'm saying. And that's what we do in whatever, because I know that it's
So
done
doctor,
that way.
But doctor doctor already said that as far as he's concerned, he obtained the consent
Yeah.
for the operation, and
And as
that's
far as
what
you-
I recorded.
Yeah.
Okay,
That's-
so
yeah.
as far as you are concerned, this part must have been signed.
That's what I'm
Because this court is now
as far
confronted with
as I'm concerned,
Documents.
this part should have been signed. I know IHK and the discipline they keep, so I know that they usually sign this. So
So, doctor, for your information, the form before you,
it's blank.
is blank, but it was given to us in this trial.
That's evidence My lord,
by
you shouldn't testify.
my lord, is it not a fact?
It's evidence. You shouldn't. Facts are evidence. Facts are evidence.
So where did he get?
Yeah,
He's explaining to the doctor.
Yes,
He got
where I got
he
it so that I put the
He
question.
got the document from the defense, so he's going to
After
ask the
we
question.
got this
I'm
document
worried. My land
from
friend is
your
giving too much
patient.
evidence.
No, he's not
No,
giving
I'm not.
evidence.
I'm not.
So that disclosure was
Doctor,
from where? It was from the
we
defense.
got this document from your patient through her lawyers. Just for your comfort. This is what your patient wants this court to believe on record as the true events that happened at the hospital. So, what do you have to say? Since you are sure that the documents you dealt with were signed, now the one who's originating from your patient are not signed. What do you have to say about that?
Let's have the administrator of the hospital come and explain, Your Honor. The role of the consultant is really at the...
Now, my question...
I mean, asking me where the documents are, who obtained, I even don't know those details. I've not been interested in this case at all.
Let the
Yeah,
hospital
administrator come and explain a few facts. Because I cannot answer those
why
facts.
that part is blank.
Yes, why is
But
it blank?
as far as you are concerned...
yes, it should be signed. That's
what
I-
you dealt with was signed.
That's what that's what I do. They should be signing and consenting. Yes, before that procedure.
Please, let's proceed with the
so if it's blank, let the administrator explain.
Doctor,
It's not my role.
please calm down. That has already been noted. Let's proceed with the next question.
So, doctor, at this point, would you not agree with me that hospital documents have been fabricated in respect of the situation?
I don't agree with you. Omissions might have been made because I see many blank forms. Even my form is duplicated 2 or 3 times. So there are many blank forms. I don't know whether the actual one was missed or whatever. So I think let's not go into areas where I cannot answer. The one who avails these documents is yes, the administrator of the hospital.
Exactly.
Why some
Now that
information is
the
missing?
Administrator availed things completely different from...
So
what
I cannot
is
answer that question also.
So let's proceed. We have already taken note.
Master
of
Blood.
that.
Mr. Kabega, we proceed. Now, also before operation, there are specific vital observations that you as a surgeon must undertake. Correct or not?
It's a vague question, Your Honor.
Sorry?
Mention the vital signs.
Okay. Would you interest yourself in the cardiovascular
Anesthesia is the one in charge of that.
anesthesia?
Yes.
You as a surgeon, you are not concerned.
Yes. When he tells me things are fine, I go in and we operate.
So in this case, what did the anesthesia tell you?
She can tell you when they come to court because I mean they agreed that the patient is fit to have the operation.
And that's why you went
Yes,
ahead.
and actually I was actually a peripheral or secondary surgeon because the major problem was the bleeding from the scalp. That would have killed the patient. Me, I'm fixing bones.
Okay, we already know that you told this court already that you handled minor injuries. But
No, they're not minor.
No.
Peripheral.
He said he was a peripheral.
The peripheral
no,
injuries.
my lord,
Yeah.
before. He's on record.
No, they're not minor.
Okay, don't worry, the record is there. We
They're
shall.
not minor. Don't put
When you
words
have a
in my mouth.
pimple.
So, would you, as a surgeon, interest yourself with the respiratory status of the patient you are just going to?
Yes, the anesthetist tells us everything is fine. The patient can go into surgery, and that's all. I don't have to go and check what is the because I trust these are professionals.
If you had just said yes, we would be on the second question.
Because yes, okay, let's continue.
Would you interest yourself in the periphery oxygen saturation of the patient you are going to operate? Yes?
The patient should be fit for surgery, and the role primarily is for the anesthesiologist to ensure that all those parameters are in the normal range. My role is different from that.
So in short,
So I should operate a patient who is fit.
in short,
Yes.
it is the anesthetists
Yes.
who
And they are monitoring
who concerns themselves with the vitals,
Yes.
and they are the ones who will
Yes.
tell you that proceed.
They proceed.
So it's
Everything is
you-
fine.
For
Yes.
yourself, you don't do
Yes, you
your
don't.
own.
Unless there's a big incidence. Yeah. And usually they told us stop. If there's an incidence like that, like a cardiac arrest, you stop the surgery and then they first cater for the life of the patient.
Okay, so where would the anesthetist inform you this? Verbally or on record?
Verbally.
There is no, they are not required to put it
Or
on
to
record.
bring it and whatever. They write it.
They write it down.
They write all their records down.
Oh, thank you.
The anesthetists.
You as, okay, you as surgeon, do you interest yourself with the written instructions or position of the anesthetist? You don't?
Of course, I'm interested in the patient being fit for surgery.
Now I'm talking about the record.
So the details of what is the temperature at that point, I'm focusing on what I'm going to do. Your Honor, it's a delicate thing to treat
Don't worry,
patients.
just
If
answer,
I start
just answer.
looking at all the details, that's why we're a team. I would be losing my focus on my operation.
So after, when you have started the operation, the anesthetist has said everything is okay.
Yes.
The operation is ongoing.
Yes.
And then
I don't have to
something
keep peeping
happens,
at-
and he says, stop.
Yes,
stop,
that's when I stop.
He notes.
Yes.
At what point do you interest yourself with those notes? After the operation,
After the-
or as long as all goes well,
Well,
it's okay.
as long as things are going well, they are monitoring the cardiovascular, they are monitoring all the vitals of oxygen and everything. As for you, you're doing your surgery. And usually we put even a screen so that we don't get alarmed. We don't want to be watching the blood pressure as it drops. For them, they are controlling that. All right? So that we don't panic in the operation. For us, we focus on what? On our operation. Sometimes the blood pressure goes up and then they give a drug, it goes down, they give a drug or blood or whatever, it goes up. So in other words, all those details are taken care of by the anesthesiologist for you as you focus on what? On the real surgery. The only time when the anesthetist peeps this side is to see whether the patient is bleeding a lot from your operation. But usually, if there's no problem, each one does his what? His work. Thank you.
Now, I am, as a person who was present in theater, I want to verify so that you tell this court whether this record reflects what truly happens in theater or not. Just go to a form immediately after assessment form.
Mr. Mwaganya, what form are we looking at?
What form? I don't know what form you're talking about.
The very form where you are. Which form is it? Terracotta?
Okay. Follow on clinical notes.
Was the record taken of your patient's respiratory status
At several times.
under RS? Isn't it? Several times. But let's look at,
Assist.
was the record taken or not?
Yes, it was taken. The respiratory rate on this form is there.
What was it?
16 beats per minute.
Confirm.
RR, respiratory rate. 16 beats per minute. O2, SpO2 98%.
Okay. Confirm that that is a normal respiratory rate for a person.
Your Honor, I'm really being taken into fields which are not mine. And I feel like we are repeating this after. It's like I'm being irritated to start.
If you can't confirm, tell courts you can't confirm.
Let the anesthetist come and answer. This is
the normal beats per person is not, the normal beats is not within my expertise.
It's not within my expertise.
I've answered. This
is not my
is not my area of specialty, and I feel like I'm being.
Rather than complain and get worked up,
But
if anything is asked that he feels is not within his
I don't know the respiratory
but my
rate
lord,
of
you-
a patient.
He should just
That's
say-
what you're.
My lord, you were saying let him confirm. Yeah, for him, he has said that's outside my area.
I was
It's not my
saying
area.
that it's not out.
Yes.
That's
Yes,
what I
okay,
meant.
okay.
It's out of my area.
If it's
out of
out
my
of your
area.
area, just say it's
Then
out
it's
of
It's
my
out
area.
of my area. That's
Move.
what I can answer.
Thank you, my lord, for the advice. Please, and let us be understood, we are not forcing you to answer anything that you don't know. Only answer to that which you know. Periphery oxygen saturation. What was it?
My lord, if he has answered that oxygen circulation is not his area,
They are not the
should we
same.
continue on this path?
No, they've asked, I don't know.
They are not the same.
What is respiratory status? Isn't it the beat?
My lord, the doctor
So-
who is supposed to help court
So periphery
doesn't know.
oxygen circulation?
So I'm on another
Yes, I think that this should be answered by the anesthetist. Areas of saturation, respiratory.
SpO2, what was it?
So just a moment, what was the periphery oxygen circulation? What was the number?
Doctor, can you read to court the number? So, this is I see SpO2 98. I see respiratory rate 16. no, let's go one by one.
Mm.
So SpO2 standing for peripheral oxygen saturation is 98.
So whether this is normal should be answered by the anesthetist.
So you,
whoever-
even this you can't tell whether it is normal or
I
not.
can tell, but I'm not going to answer that question, to your honor, because I've been very clear.
Okay,
You are
let
taking
my
me in
lord
an
write
area
that.
that's not my whatever.
Let my lord write that.
Yeah, please let them come and answer their
My
questions.
lord, can court observe that?
Yeah. Yes, because I'm very categorical.
Let's go to the next.
Taking it to an area that is not mine. That's his answer.
She was tested for spontaneous breathing, correct?
I would like
The
to
record.
I would like to request that these answers are given by the team that handles that area. Your Honor, it is taking me into fields that I don't belong to. And I'm not the one who recorded this, and these are the teams that recorded this. Those people are there. The administration has all the details.
So, doctor, that was part of the documents that accompanied
Yeah.
the
patient.
patient to the theater. So for those ones that you cannot answer, because you looked at them, for those ones that you cannot explain, simply say, I cannot explain.
So I cannot.
If there's anything you can explain,
Yes, it's concerning the injuries that the patient
you
had,
can-
that I worked on.
you can only explain the injuries, the vitals.
The vitals, and anesthetic team, and the emergency doctor and administrator will address those.
Was she tested for the respiratory rate before your operation?
No, whether they were tested is different from explaining.
Because my lord, if he's not the one who was testing those things, really, are we not enlisting here?
But before he does the interview, the operation.
He gets assurance from the
Mazen-
anesthetic.
I'm assured that that the anesthetists did their work. I pray that when he comes here, he's asked these questions. Because my role is
Dr. Sechi,
on the hands.
okay, when the anesthetist
And he tells me that
comes, just
everything
a
is
moment.
fine. Yeah.
So before you start operating
Yes.
the patient has been
Yeah.
prepared, the anesthetist has done whatever they're
Yeah.
supposed to do. So when you now get this form, does the anesthetist tell you, omnibus, that I have done all the vitals, or he goes one by one and
With them. So whatever they recorded, I pray that those people answer those questions. Especially out of orthopedics. My issue is the injuries.
As an expert, you are on the stand. Is on the stand as an expert, isn't it?
Expert orthopedic surgeon.
Yes. He's on the stand as an expert.
Expert orthopedic surgeon.
As an expert orthopedic surgeon.
Yes.
But as an expert orthopedic surgeon, you also concern yourself with the state of the patient before you proceed with the operation.
Yes.
Which is in the vitals.
Which is in the vitals, which is taken care of by the anesthetist.
Yes.
And then the neurosurgeon also is concerned.
Yes.
And the neurosurgeon is going first into the operation. And I'm the one going to next after the neurosurgeon to fix the hands. So that's it.
So
that is fine.
In this operation, you relied totally on the expertise of the anesthetist.
Yes.
And on the fact that they had done everything, and by the time they told you the patient is ready, you believed that all the vitals had been taken.
Yes. I believe in them, honestly. The standard of conduct in IHK is very, very thorough.
Now, you as an expert, I've noted here that on the peripheral oxygen circulation, when you were asked as an expert whether that is normal, you said that is normal, but you will not answer. Let the anesthetist come.
It's normal.
Whether this is normal, this should be answered by the anesthetist. I can answer, but I will not answer. Yes, that's what he's saying.
Yes.
So that means he can answer, but his delivery.
I am praying that if I start answering for everybody, I'm going to, my time has already, I've been here 4 times.
As an expert. As an expert, this is within your knowledge. Because if it was, say, let's say, I don't know whether it is possible, 50 beats per minute, you as a surgeon, you would know that that is normal or not. So you can answer.
My lord, the danger with that is that we're inviting this witness to answer, first of all, on what other people did, and secondly, to give medical expertise that he doesn't ordinarily do. If you went into theater, would this doctor be in charge of your vitals? The answer, that's the question. If you went into theater, would this doctor be in charge of your vitals?
Doctor, if you looked at vitals, for instance, respiratory status, spontaneous breathing, peripheral oxygen circulation, and you looked at the figures, would you be able to determine whether this is normal, this is below, or this is above? Would you be able to tell?
I can tell.
Yes, so please help court. Based on what is written
Your
there.
Honor, Your Honor, it is not my area of specialty.
Yes, but you can tell.
And,
it is
and,
within your knowledge.
and 2, it depends on the patient and what the anesthetist has given. It may be the normal law. So the anesthetist has a lot of details they'll tell you. He might have given a drug that drops the whatever. So when I start answering those questions, I go into more questions, which I may not even be able to answer, because they are handling that area very delicately and well. Sometimes even they cause hypotension so the patient doesn't bleed a lot. These are all jargons of anesthesia that I cannot, because my answering them is that I don't know why they are doing them and why they are low or they are high, whatever.
But scientifically,
so I'm
a reading is a reading, isn't it? So a reading taken at that time, this record was made. A reading is a reading.
A reading, yes.
That is what it read.
That's what it reads.
Time.
At that time. But I want to tell you, Your Honor, that low can be caused by the drug that the patient is taking and other things. So what I'm saying, when I go into those details of whether this was law and why it was law, then it's not my area of what.
No one, you're not being required.
No, I don't know,
to
because
analyze.
that's what has been happening. I'm
No,
being taken to areas
you're not being asked to analyze.
this is a Google.
It's not being asked to analyze. It's being asked to tell us.
This information is on Google. I'm not going to answer the physiology, respiratory system, all those things. I'm a very honest person. I am an orthopedic surgeon, and I handle orthopedic operations. I pray that I'm just taken in my field, and we finish the day. Because if I start answering for all those things, it's difficult. Yeah. I told you, it's not my field.
If it's not your field and we have put a question, tell a court that I don't know that one because it's not in my field. But you cannot refuse to answer.
So that's what he has said.
That's what I've said.
That is not in my field.
So
that we should ask the anesthetist about all the questions
so in
that
other words,
relate to
yes,
the
my lord.
vitals.
In other words, doctor, your competencies cannot enable you to read vitals, including the respiratory responses, oxygen saturation, whether a patient is breathing well or not. That is beyond your capacity, your professional capacity to handle, correct?
Your Honor, that's what I was telling you. I'm a lecturer of Makerere University. I'm head of department. So, asking me such a question, you are challenging my professionalism. If I tell you, you are taking me in a profession that is not mine, in that area that's not mine.
Dr. Sechin, we've asked
you. I may have information, okay, because I handle patients.
The prosecution has asked the question, and you have said that is not for you. You would like the anesthetist to come, you're not going to ask.
Yes.
So, he asked a follow-on question. Can your competencies allow you to read?
Yes, they allow me. But I will not give evidence in that area because it's not my area that I was handling.
My lord, we request the court notes that actually, doctor, the reason from our instructions why you are extremely guarded about providing this information is on that day second, you were not anywhere near KATANGA at all.
That is hearsay, Your Honor. I was the one who managed the patient. So it is hearsay, and I don't agree. That's all I can say. I don't have to explain anymore.
You already told this court of the telephone number that went on record, and you confirmed that it was with you all the time on the second. Doctor, I have, through a court process, run your telephone number, and I want to give you the record.
Mr. Karuranga is requesting.
He should always learn to be patient. Yeah, there is another copy for Karuranga.
Surely, my lord, I know that the court has said that there's a different law of disclosure when you're cross-examining witnesses, but surely.
I've not said there's a different law.
But surely, my lord.
I've stated that in matters that come up in cross-examination may not be reasonably anticipated at the time the full disclosure was made. So in that respect, disclosure can be ongoing, and I haven't quoted some of them. I did not, don't put it as if I am saying that there is a different law.
My lord, my colleague behaves as if he has a license to simply walk into this court every day with new evidence, to start investigating witnesses, subjecting people to that sort of real harassment, actually. But anyway, let's see.
Mr. Karuranga, look at, has he given you the document?
Yes, it is my
duty. You need
duty.
some time? No. Let's look at them and we continue. How many minutes do you need?
5 minutes.
In the meantime, please translate.
intention is adjourning, but we are going nowhere. We are ready. Yes, we don't want to. The intention is we go.
My Lord, we didn't come to adjourn. Actually, we would have almost finished, but we are not getting clear responses.
No, you are just testifying.
I know. Science doesn't have yes or no questions in the manual.
Science should tell us.
Mu mateeka ga badaktari omulwaire olundi omujjanjabi we alina kwikiriza ebyo byonna ebigenda akolebwa hali omulwaire kandi mu mulingo guno Patricia ali nk'omwana wa akuzaalwa Mole akayikiriza bamuhe ekitabo omwirwaro essaaha 3:25 kandi baitu okwikiriza ayikirize rundi okwikirizibwa okusemezebwa okumanyisibwa titukutungire kubuziremu mu bihandiiko byonna ebitwakarra hati gali mazima nti mu mateeka omuntu ayina kusaba kandi ayina kwikirizibwa okuba nasobola kukora hali omulwaire weena ekyaba ayina kumukoraho kandi guli mulimo gw'omujjanjabi abandizibwaho nuwe ateekaho omukono omubigufu hali ebintu bino byona kandi kino ekihandiiko ekitwerizibwe hano kyo kikoleka nti tikina hali omuntu ena yahandikire rundi hayateire omukono gwe omubugufu okugumya ebyo byona ebizire nibibazibwaho kandi hali ekyo asabire omukuru w'eirwaro aije atusobole habwaki olupapula runo lutateirweho omukono rundi lutahandikirweho ebikaba bina kuhandikibwaho kandi ekigambibwa nti ebihandiiko bino tibihandikirweho rundi tibirinka okubirina kuba nti habwokuba biri byebisuba nakyo kyo takwikiraniza nakyo baitu asabira omukulu w'eirwaro aikirizibwe aije atusobole habwaki kikusana kityo kandi wenka daktari omulimo gwe wenka daktari ayina kugambirwa nti omulwaire ali kurungi kandi ategekeibwe okusobola kuba nasemezebwa kandi bino byona abajjanjabi ababandizibwaho baba babihandikire omu bihandiiko ebibayaba nibakora bakora nk'ekitebe kandi buli omu abaina omulimo ogwakora hali omulwaire kandi kandi buli omu nigwo omulimo gumuleesere nigwo akora ebikwatagana hali okuhikya kw'omulwaire nebindi byona ebikumukwataho taija kusobola kubigarukamu habwokuba ebyo tibikwatagana hali emirimo ye eyakora haliho ebyakumanya baitu taija kusobola kubitusobora habwokuba tiguli mulimo gwe ekyakusobola kusobola kiri kintu mu kyonka ekikwatagana habihuta nti kandi ekikumugambibwa nti ekiro ekyo ekyebekwezi 2 akaba atali hantu hona omwirwaro na Mole ebyo nabyo byokuhura buhura kandi bisuba tigali mazima
Okay. Let's continue. Doctor, first I want you to confirm that the particulars covered on the printout that I bear here, that I have here, are yours.
Yes.
I'm asking you to address your mind to the KYC details. Do they belong to you?
Yes, they belong to me.
The photograph belongs to you?
Yes.
It is the photograph you used in registering your telephone number. It was taken at the point of registering your telephone number.
I've been with this number for a very, very long time.
I know.
Yeah, so you cannot.
The national ID captured on the subscriber details belong to you, correct?
It's mine.
Use the mic.
This one?
Yes.
It's mine.
And the telephone number indicated up that for your privacy, I will request court to look at, is yours for emphasis of record.
Yes, it's my number. 077247.
Doctor, confirm that the national ID annexed on your KYC is yours.
Yes, it's my ID.
The next document confirm that the MTN registration form is applicable to you, to your number, and it also bears your particulars.
Yes, it bears my names and particulars.
Go to the print, the section of time 9:59. On the for the second November 2023 at 9:59. Are you in that column?
Mm-hmm.
Where is that?
Are you there? It is the 6th from down.
No, that's an incoming call. So is that the location of the person calling?
Please.
No, because you see, my lord, we shouldn't allow someone to mislead court. Are you talking about an incoming call?
That form, my lord, shows both incoming and outgoing.
No, you've asked him about 9:59, which is an incoming call, right?
No, he's just asked.
My lord, that time is the same.
He has asked about the time. Okay. Let him get the question first and then you object.
Doctor, please consider the column of 9:59 on the day in issue. Are you there?
Mm-hmm.
Are you there?
Yes, I'm there.
Your telephone received an incoming call.
I cannot interpret this.
You can't interpret.
It has no heading, so you are the experts.
Yes. But your location, the last column, you were at Nakasero 4. Do you see that?
That's the objection I'm making. It's also not clear, my lord, because there are no headings, where the location is for who is in.
My lord, can I deal with
Just a moment.
No, my lord, it's important that we.
Let him.
No,
Mr.
because he's asking him about.
You have said that that is Nakasero.
No, I haven't said that.
No, you're saying that it was an incoming call.
An incoming call, and this document has no headings to know.
You're meaning, according to you, the caller is the one who was in.
No. The document has no headings. We don't know who was. What we can see from this document is that this person, there's a person in Chisugu, there's a person in Chiswa, there's a person in Chiwuliriza, there's a person in HB Towers. Those, my lord, are clearly within the area of IHK, for your information.
Mr. Mwaganya.
Is the one ever accusing me of testifying?
No, because, my lord, this witness cannot testify to this document.
Mr.
And that actually is the objection, my lord. This document here, my lord can check all the call records we have in court. They all have headings. We need to know who is who is where. We need to know more. You can't just produce this piece of paper and then you tell us you've got a court order. Then you tell us you've got a court order. For all we know, this could be typed. You may have got a court order and you may have typed this.
The court records we have before court have headings.
Yes. From them. In fact, my lord, we had a witness here explaining to us about different times. You will notice that in this call, for example, at 9:53, the witness is in two places. He's in HB Towers and he's in Chiswa at the same time. So we don't know who is where. There is a witness who is in Mutungo and another one who is in Kololo. Who is where? There is someone this. We don't even know the duration of these calls. The call records show duration. We have no idea who the author of this thing is. It's not a matter of just going and saying, this document is just the queen of incompleteness. It is designed deliberately to be evasive. What I can see that maybe may interest Mr. Mwaganya is that, anyway, let me not tell him what may interest him. It will interest me. But my lord, this document, I'm objecting to putting this document here with no author, with no titles, with no headings, with no understanding to this witness, and then using it to try and place him in particular locations. It is not even his own document. And my lord, moreover, it is a document that does require technical explanation, because we are seeing these, my lord, are cell tower locations. They're actually not physical locations. We don't know where the cell tower picks you. That's what a witness told us, PW10. Told us that these are simply cell tower locations. They are not exact locations. Also, my lord, we don't know what is where. I'm not wasting time. I'm raising an objection. And this is the problem, my lord, of lack of disclosure. We would have all been able to know that this has been done. However, now we have a situation where this witness is going to have to explain. At 7:07, for example, he was in two different places. At 9:52, my lord, unless he's even the US Army that's throwing missiles in Iran cannot teleport with such efficiency. Moreover, my lord, this is an application which was made on the 15th of October, 2023. An application which was made on the 25th of June, 2026. We will need to know, because we know, for example, that telecoms may not keep records for all that time. We really do need to actually examine this document. My lord, no question can be put to that witness on that document, because as you can see, you have one minute and different locations. My land friend cannot place him at a location using this document. What he could have done, he could have got the Seda Congo Bibiana, who was, and brought her here to determine if there was an operation or not. My lord, can it really be said that the issue of whether Mole Katanga was operated or not is something new that has come up in cross-examination? And the court order, my lord, is very clear. It is for documents from the 15th of October to the 15th of November. The document we have here is a one-page document. My lord, the court order we have here is very clear. Now, we don't have the full document with which Akongo Bibiana went to get. My learned friend is talking about yeah. So my lord, we need to really have a look at, no, we don't even need to have a look at, my lord. The whole thing is incomplete, it is meaningless, it is unclear, and it is not, it is easily doctored, and it's not something that should be put to the witness, especially, my lord, when you just look at the details. Chiswa, Chisugu, Chiwuliriza, those are areas, my lord, within IHK area. My land friend is then talking of City High, Naguru. If you look at the times, my lord, that someone was in Kololo and was in IHK within 1 minute. How can anyone explain this except a technical person?
Mr. Karanga, you're finished?
Yes, my lord.
Mr. Mwaganya.
My lord, our interest is to know where Dr. Sechimpi was at the times he told court he was in theater.
I was in IHK theater.
So, the doctor can say what he wants to say, but we really feel he should answer for himself. Should counsel have any doubts, as he appeared to be raising it, my lord, he can handle those doubts when his turn comes, in exam, in chief, rather in re-exam. As to the other issues, my lord, he is raising, this is cross-examination, my lord. I could even confront this doctor with any information. It is up to him to tell this court that it is wrong or false, and then we move on depending on his position. So it's not fair, because Mr. Karuhanga is saying somebody is in certain places which he even knows that they are supposed to be in the location of Kiswa.
So, Mr. Mwaganya, so, you got a court order?
Yes, my lord.
And you obtained that document?
Yes, my lord.
And what shows that that document is given to you by the person who was supposed to give it to you?
My lord, you can see the court order is there. Even the person that secured it is there. There is a stamp on the subscriber form of the service provider, same signature, same date, same stamp. Even on the national ID, which the witness has accepted, is subscriber form, which the witness has accepted, and finally on the print.
And where could those details be obtained from?
My lord, these are from MTN.
How do you know?
The stamp and the court order speaks for itself.
But the court order is for a different document.
What do you mean the court order for it? What does the court order speak?
My lord has a brief rejoinder.
Is for which document?
The court order is for 15th. It's a whole month.
A whole month.
Okay.
Now here you have 1 day.
You have 1 page.
My lord, when the court order is for telephone number, this which the doctor has confirmed.
Okay.
Okay. The one applying for it is also clear. Is there, and then what is being requested for is KYC, and then we are requesting for call data and location. Yes.
From?
Yeah, from 15th, 15th October to 15th November. Our date of interest is the 2nd. So I am dealing with the specific responses of the 2nd.
Your area of
interest is 2nd. That day the doctor says was in theater. As to where he was on the 15th,
Mr.
my lord.
You proceed with your document.
Most obliged.
If they have any issues to attack, they will attack them in re-examination.
Are you saying that the witness can look at a document he has not authored, that is not tabulated, that is not consistent with the court order? My lord, these are serious objections.
The witness has identified those other documents. They are his documents, and that is...
We have no problem with the documents
that
which
is
they,
his, yes, the
which they
attached
have
documents,
identified.
yes.
Our problem is
And-
with the call
and
data
that-
record.
The call data record is in respect of which number?
How do we know? My lord, there's no heading on this document.
Even in the printout.
No.
The number is in the printout.
No, but my lord, how do we know it's the number? There's no heading. There are other numbers as well.
The number is in the
Is in the
printout, isn't it?
statement itself. And the statement shows you incoming, outgoing.
My lord, we have on court record call data records. My lord, let's look at that call data record.
That the witness cannot answer this question is?
My lord, we have a call
Numbers
data.
there?
Yes,
No.
my lord.
Is this from MTN?
Yes, my lord.
Is this a court order?
That is it.
The witness has identified the document.
My lord, let's look at the call data records before court. He identified other documents. And
I identified my own
So
records.
his number, he has identified his
You're
number.
not the document.
My lord, the call data record. My lord has no headings.
This document has the security department, MTN.
That's a stamp.
26. Yes, it is stamped.
That's a stamp. My lord, I'm talking about,
Just
my lord.
just as the rest are stamped, the same
No,
stamp
my lord,
appears and
my
the
question
same
is,
signature.
my lord, from that Excel sheet, what tells you that that's Dr. Sechimpi's number?
It is here.
Where on that Excel sheet?
This column is here. It shows, I cannot read the number, but it is here.
No, my lord, you look and see.
This column.
If I can show you, my lord.
1, 2, 3, 4. This column has the number.
Only one number appears on that column. My lord, is there a single column on that page which has only one number?
So what am I supposed to be asking if you want to preempt
Yes.
issues of numbers?
The fourth column.
that to me.
Mr. Mwaganya.
So he's saying that the fourth column, now my lord, it's very simple.
Mr.
We have here on this court record, call data records.
Miss-
Let's look at them, my lord, and see
Miss-
if they look like this.
Mr. Karuhanga, this document is pursuant to a court order.
Let us see, even that court order, my lord, we need to be clear.
So what is the objection, my lord?
And then
We should
the
not
court
interrogate
order was
where
taken
Mr. Sechimpi
to
was.
the security department and verified.
My lord, I think let's first look at the court order. Just look at page 1, my lord, of the court order. Look at the court order, my lord. This court order, at least the one I have, has no seal, but just look at it, my lord. My lord, look at the court order.
You're denying the court order?
Yes, look at it, my lord. My lord, if you look at the law, just look at the law. Yeah, let's look at the law.
Since the court order is in issue, let's give the defense time. Go and verify the court order.
Most obliged.
Go and
No.
verify those documents, even from MTN.
Most
And
obliged.
then we shall continue when that is done. The person who received the court order and implemented it should speak to it.
My lord, we don't even have the name of a magistrate. Can we at least know?
That is why let's take time to verify.
Well, no, my lord, the reason why.
No, Mr. Karuhanga.
My lord, there's a reason why.
Karuhanga, let's verify that.
Yes, but my lord, my prayer to you is that you make orders for this verification.